Friends, welcome to today's webinar. And today we have a panel of speakers. That is Dr. Tejinder Singh, who needs no introduction. He is a professor of medical education at Shri Guru Ramdas Institute of Medical Sciences, and also earlier he was director of the CMCL Framer and VC Roy Award winner, and a lot of achievements. Dr. Rajiv Mahajan happens to be the principal of Adesh Institute of Medical Sciences, and he is also a professor of pharmacology, and again very prominent in CMCL famous circles. And along with him, we have Dr. Jyoti Nath Modi from Bhopal. She is a gynecologist and again a very famous educationist. Over to you, sir.
Thank you, Sanjay. Good evening, ladies and gentlemen. It's a pleasure to be speaking to you again, this time on one of my favorite topics, that is programmatic assessment. As Sanjay already told you, I, along with my colleagues, Dr. Rajiv Mahajan and Dr. Jyoti Modi, will take you through various aspects of programmatic assessment and then see how it can be adapted to the Indian settings, particularly in the context of competency-based medical education. So before I start, Sanjay, there's some problem. Hello.
Dr. Jyoti, yes, sir. Yes, sir.
Yeah, the screen is not working, so
I'm not able to advance.
Okay,
sir,
done,
just
done,
press
done.
the escape
button. Done.
Yes.
Done. Okay. Thank you. Okay. So before I start with the programmatic assessment, I'd like to take you back to assessment for competency-based medical education. And many of you who had been with me in the previous webinar on the power of subjectivity would remember this model that we had presented. If you look at this model, the interesting part is that the majority of assessment for competency-based medical education is actually formative rather than being summative. And summative forms only a very small part of the assessment in competency-based medical education. When you talk of formative, you're talking of not only feedback, but also feed up and feed forward. I'm sure most of you know these terms, and I won't elaborate them here. Then building a learning orientation in all assessments so that the students engage in self-assessment, they engage in reflections, and they are directly observed using various tools of workplace-based assessment. Now, would actually revolve around this model because this is what is going to be the guiding model for rest of our things. Let us recap quickly the various concepts as applicable to assessment. It's my personal feeling that most of the issues that we have with assessment today are actually because of a lack of proper understanding of the terms like validity, reliability, etc. And to be sure that we are all on the same wavelength, let me repeat here that validity refers to the appropriateness of interpretation. It does not refer to the tool, rather it refers to the interpretation that you make. Secondly, it's not context free. So it's not that if a tool is valid in one setting, then it will be valid in every other setting. Just as an example, what is valid for selection test may not be valid for the certifying examination and vice versa. So validity is not innate property of a tool. So you cannot say that MCQ is a valid assessment of knowledge. There are so many ifs and buts attached. And with the newer forms of assessment coming, with older ones to some extent, the tools could have been said to possess these qualities, but with the newer assessment tools coming in, validity resides more in the user than in the instrument itself. So, in other words, what I'm trying to say is that rather than just saying MCQ, what is in that MCQ is what decides the validity or not. Same way, it's not just OSCE which decides the validity of a clinical competence assessment. It is what is in the OSCE which is more important. And you would recall that appropriateness of the sample and size of the sample are two very important factors which actually decide whether the validity is going to be of an appropriate degree or not. Sorry, there's some problem with the system.
Just press the escape button.
This is not advancing.
And then page down. Escape and page down.
It seems to be stuck. So probably I'll need to get out and then again get in.
Yes. Yes, Dr. Jyoti.
Okay, I hope it works now. Second important attribute of assessment, that is reliability. Now, I have said it many times, and I hope many of you would remember this, that reliability is not simply reproducibility of the results. Everyone giving 5 marks is not reliability. Everyone marking according to a wrong checklist is not reliability. For educational purposes, it's always better to see reliability as the degree of confidence you can put in your results. How confident we are that the student whom we are saying as fit to practice is actually fit to practice. That is what is reliability. And as you would have noticed, that this kind of reliability or this aspect of reliability will not come with one or two assessments. We'll talk about it more a little later on. Like validity, reliability is also not an innate property of a tool. How you use makes the assessment reliable or unreliable. And reliability is not synonymous with objectivity or standardization. So MCQs, for example, might be very objective. But if you were to give only 5 MCQs at the end of 1 year's course, you cannot rely on those results. You cannot depend on those results. Same way, OSCE, for example, is very objective. But if you are using it to test only very low levels of skills without looking at the integration of knowledge, skills, and attitudes required for a clinical competence, then again, you will not be able to depend on the result. And like validity, it is the representativeness and size of the sample which again decides whether the results are going to be reliable or not reliable. There seems to be some problem because it gets stuck. Okay. My apology for the problems because system is getting hand in between. Anyway, third important part, which I want to recap with you today, is the concept of utility of assessment. I'm sure most of you have heard about it. And let me add that this concept, which is a notional concept, you don't really calculate out a formula. You don't really multiply something with something. Just a way of looking at the utility of an assessment. This was one of the game changers, I would say, as far as assessment is concerned. So when you have validity, reliability, feasibility, acceptability, and educational impact, what is important to remember is that there is always a compromise between these tools. In our basic workshops, we have always learned that a tool cannot be valid unless it is reliable. But in actual practice, what happens is that if you keep on increasing reliability or do interventions to increase reliability, your validity actually keeps on going down. This is because many of the aspects of clinical competence cannot be captured by objective methods. So the more objective you try to become, the more sacrifice you are making as far as the validity part is concerned. And this is very important to keep in mind that if there is going to be compromise between these attributes, then no assessment tool can be used for all the five attributes which are being mentioned. Now, this has got a very important implication. We'll deliberate more on this part. Now, if there is a compromise, then what happens is that we work with suboptimal combination. Either the sample size is not enough, or the sample size is not appropriate. And the result is that we actually end up harming both, not only validity, but also reliability. Another problem which arises is that the kind of assessment practices that we have, they generally promote test biasness. What it means is that the students learn how to score better marks without really learning how to apply the knowledge to solve the problem of a patient. It promotes surface learning. They don't go into deep learning. They don't try to form associations between different pieces of knowledge. They don't frame associations between, for example, basic sciences and clinical sciences. And so when confronted with a patient, they have a problem in making a diagnosis. And therefore, it is small wonder that actually most assessments have a negative influence on learning. Now, this is something which is increasingly being recognized since last 20 to 25 years, that the way we assess, we are actually promoting a negative influence. Now, if you look at the traditional assessment, and if you look at the minimal reliability, I'm not saying 95, 90% or something, a minimum reliability 80%, below which actually it becomes difficult to really depend on the result. So it requires a minimum of 3 to 4 hours of testing. We do not have that luxury of spending this much time on each student at one examination, whether it is a send-up examination or it is a pre-university examination or it is a university examination. It's really difficult to spend 3 to 4 hours per student. And even if you were to do by, for example, extending the duration of the examination or similar intervention, still, and that's important, 20% will be false positives or false negatives. So you will still be passing at least 20% of the students who don't deserve to pass, or conversely, you would be failing 20% of the students who actually should have passed. Now, this harms assessment and learning in more than one way. Students do not trust the assessment, and therefore assessment loses its value as far as learning is concerned. And as I told earlier, that even with the best of methods, compromises have to be made, either in terms of validity or in terms of reliability or in terms of feasibility or whatever. But experts are very clear that you should never compromise on the educational aspect. You can compromise on validity. You can compromise on reliability. No problem having a little degree of error in making an assessment. But at no time your assessments should be low on educational impact. The purpose of assessment, I would remind you, is not only to prove but also to improve. So what is the solution? The solution is to optimize assessments so that you can make meaningful compromises. See, after all, you cannot be 100% objective all the times, and not all subjective assessments are going to be wrong. Let me add here that if you look at our current university examination pattern, then everything that we are assessing is actually subjective. Whether it is a long case or it is a history taking or clinical examination or viva voce or essay type questions, everything is subjective. But still, we do get information out of it. So if you have to make compromises, then make meaningful compromises. And meaningful compromise means never compromising on the educational aspect. What I like to point here is that this optimization of assessments cannot be done at individual level. You cannot do it at one send up, or you cannot do it at one class examination, or you cannot do it at one university examination. This optimization can be done only at the level of a program. We'll talk about it a bit later. But one of the solutions that we have to look for is to have a program of assessment where you can optimize assessments and where you can make meaningful compromises so that the learning value of assessments is not reduced. So you might be wondering why this name of programmatic assessment. This is because assessment constitutes a program which is as important as curriculum itself. In fact, I would like to take you back to the process of creating timetable for the first years for competency-based medical education. Most of us put in a lot of effort in designing timetables, integrating, and so many other things, but hardly any effort actually went into designing assessments. So there was a program of teaching, but unfortunately, there was no program of assessment. And unless you have a program of assessment, you cannot chart the progress of the student as is happening through the course. Just think of cross-sectional and longitudinal studies. Our current assessments are like cross-sectional. At one point of time, they'll tell you something, but they will not tell you about the progression. They will not tell you about the factors which have an influence on progression. They will not tell you about what are the major deficiencies which the students have, what can you do to overcome those deficiencies, and what the assessment program should do to the learning program so that the progress of the students is based on aggregation of data points rather than one assessment. Now, this is the key component, and I'll elaborate more on this point. We all have mobile cameras with us in our phones, and we have heard these terms pixels. Now, when you look at the pixel, individually they do not mean anything. But when they come together, they start creating a picture. And more the pixels, more clearer is the picture. Something similar happens with assessment. So just like in a picture, more the pixels, clearer the picture. Same thing happens with assessments. More the data points, more is the clarity of information you have about the progress and learning issues surrounding a student. Now, when we have to make educational decisions, I already told you that validity and reliability are not innate properties of a tool. So there's nothing like a valid or a reliable tool. How you use the tool, in what combination you use the tool, makes all the difference. And if there is no valid or one reliable tool, then it is unfair on our part to make educational decisions on inadequate or imperfect data. I gave you that 80-20 example. Even with the best of intentions, you still may be making error to the tune of 20%. And unfortunately, in this whole cycle, it is the improved function of assessment which is totally. So one of the ways to overcome this is that each assessment should be treated as a data point and not as the data. So if you have, for example, 10 assessments in medicine over a period of 3 years, then each assessment has its own interpretation, is used for some purposes. I'll elaborate more on that. But individually, it does not lead to a decision making as far as the educational decisions are concerned. So, point one, you have to delink individual assessments from decision making. Now, why this is important is that when you have all the assessments counted towards decision making, you are actually taking away the liberty of the student to explore, to experiment, sometimes even fail. Because then the 1 point agenda of the students is to pass. And in the process, they hide their weaknesses. They make you believe that they know when they don't know. And they deny you the use of a very appropriate tool of feedback to improve their learning. Dorseni very rightly said, single measurement as far as assessment is concerned is no measurement. Howsoever well done, single measurement, no measurement. And Lambert Schubert and Van der Lutten in 2012, when they came out with the concept of a model of programmatic assessment, brought in this concept of proportionality. Again, I'm repeating an example which many of you might have already heard, but for others who have not. Let's say you jump a red light, then the testimony of that traffic constable is enough for the judge to impose a fine on you. He doesn't ask for any other evidence. But if it is a case of homicide, then even a self-confession is not admissible. It has still to be proven by various evidences and various means. So it all depends on the stakes. In our day-to-day assessments, the stakes are not high, they are very low. You are not going to fail a student on a class test, for example. So you do not need too many data points. But when it comes to, for example, certification that this student is fit to practice medicine on his own, the stakes are very high. When you are selecting for postgraduate examination, for example, the stakes are very high. Now, that is where the amount of data points that you collect increases. So data points to be collected are proportional to the stakes involved in assessment. So this is the first point I would want you to remember, because we'll keep on coming back to these points repeatedly. Secondly, when we link assessment with learning, then again, some of the very important findings of educational research are actually worth mentioning. First, that assessment without feedback is no assessment. Just asking a student to write an exam and saying 5 out of 10 or 6 out of 10 does not mean anything. Not only that, marks alone do not convey any meaning without a narrative. So unless you tell a student why you got 4 out of 10, he'll not be able to improve his performance next time. Conversely, if you do not tell a student why you got 9 out of 10, he will not be able to repeat his performance next time. So a narrative becomes a very important component of learning based on assessment. And this is especially required for complex clinical skills, surgical skills, for example, communication, for example, professionalism, for example, ethics, for example. All the things that we are talking in the new curriculum actually demands an assessment with a narrative feedback. Unless you are able to provide that, assessment will not aid in learning. So point 2, which I want you to remember is that since individual assessments are not the basis of decision making, you can actually work with tools which may be subjective, but which are very high on educational impact. Communication, direct observation, for example. One can say it is not very objective, it may not be very reliable, fine, but it has got a very high educational impact. And that is what you can use. So remember this second point, that since you have delinked individual data points with decision making, so now you get the freedom to work with tools which are high on certain attributes, particularly educational impact. And I was rather surprised when I looked at some of the recent literature on educational assessment, that most of the educational research now actually focuses on how to use assessment for better learning rather than only for making a pass fail or a yes no decision. So let's keep this point in mind. Third, we are talking a lot about self-directed learning. Now, self-directed learning is required for the development of competencies. Given the long list of competencies that we have for undergraduate students, it's not possible for each and everything to be actually taught by the teachers. A lot of those would have to be done by the students on their own. And self-directed learning does not mean letting the students sit in the library on their own and just go back after a period of 2 hours or 3 hours and the thing is over. No, it requires a lot of assessment. And that assessment cannot be a high stake assessment. It has been given due importance in the new curriculum. In fact, one of the competencies for Indian medical graduates that we have decided is lifelong learner. After he passes out of the medical school, he has to learn a lot of things on his own, self-directed. And therefore, very rightly said that assessments should provide opportunities for reflections. Learning or reading without reflection is like eating without digesting. Unless we provide opportunity to the students to reflect on the experiences, on how well they could perform, what were the shortcomings, what can they do to improve their performance, we are not really providing enough opportunities for them to learn. So point 3, that individual assessments should not be used for decision making, but it should be used for reflections, for tutoring, and for mentoring. This is important because it allows you to pick up any deviation early. So, unlike the conventional process, when we would call a student before the examination and tell him, sorry, you have not passed your internal assessment, and so you cannot go for the examination. You don't wait for that time. You pick up the deviation much earlier and take corrective action much earlier. So this is the third point I'll like you to keep in mind. Then next is the issue of aggregating assessments. We work on compensatory method of assessment. So a poorer performance in clinical examination can be compensated by a better performance on history taking. A poor performance on cardiovascular system can be compensated by a better performance on GIT. That makes no sense. When we are talking of competency-based education, the student has to be assessed on all competencies. And there's a lot of context specificity. Performing well competency well is no guarantee that a student can perform another competency also well. Then we also tend to aggregate on the basis of tools. So clinical examination, spotting, laboratory work, they would all be clubbed together because they are quote and unquote practicals. But if you look at clinical practice, no one of us actually adds blood sugar to RBC count, divides by WBC count, multiplied by platelet count because they are all laboratory values. We don't do that. And we do not tell a patient that although your blood sugar is very high, your serum sodium is quite low, and so they compensate for each other. We don't do that. It cannot be done for student assessment also. The knowledge is contextual, the skills are contextual. They have to be looked at one in its own right rather than letting the student compensate for one with another. So point 4, that you should aggregate scores around the same rather than across the contents. So what it means is that it would give us a much better idea if you were to give a MCQ test on cardiovascular system, you were to give a patient of cardiovascular system, you were to assess his communication with parents of a child who has presented with congenital heart disease. If you were to look at the counseling skills of the student in relation to a patient who has presented with essential hypertension, that would make more sense. So around the same content aggregation will give you a better idea about the student rather than aggregating them across the content. So this is the fourth point that I'd like you to remember. Now, you all would remember, or rather many of you would remember, that when you were given a list of competencies, we actually broke them into objectives. Now that is required because then that's how you would teach it and that's how you would assess it. But unfortunately, stacking of knowledge, skills, and attitudes does not add up to a competency. There's no evidence to suggest that it actually happens. Learning about isolated pieces of knowledge, isolated skills, isolated attitudes about one particular disease does not result in a competency. Actually, if it happens, then come to think of it, there was no need of competency-based medical education. CDME came only because we found that this was not happening. And so you have to assess the whole task, not bits and pieces, and then hope that when confronted with a bigger task, the student will be able to put all of them together and come to a clinical diagnosis. And then assessment has to be in real life settings. It is just like the laptop example, which I often give. If you have to look at the battery life of a laptop, you have to look at the actual working conditions and then say what is the battery life. You cannot have a standardized program telling you the life and then depend on that. So let's recap the points. First, you have to delink individual assessments from decision making. Individual measurement, single measurement is no measurement. And the data points have to be proportional to the stakes involved with assessment. Now, since you are not using individual assessments for decision making, it allows you the freedom to use the tool with maximum educational impact. But at the same time, the individual assessments are not discarded. They are used to provide great opportunity for reflections, tutoring, mentoring, and allow you to pick up deviations early. And lastly, that there has to be a meaningful aggregation. Not all lab values need to be combined at one go. You need to look at the different aspects differently. Now, look at it from another point of view, that we design a program of learning to reach a certain level of clinical competence. And after we have taught, we bring in the assessment, but unfortunately, it's not really directed towards what we have taught the student. And in fact, higher the stakes, the more this difference becomes visible. Look at the PG entrance examinations, for example. You ask what you don't teach, and you teach what you don't ask. So there's always a mismatch. Now, there are reasons for that. There are reasons. I mean, you cannot have entrance exams simply asking for RBC count or WBC count. You cannot do that. You have to move beyond that. Otherwise, how do you select a very small number of candidates from a massive majority? But then it spreads on to the way we are teaching, and it creates problems for us. We have all lived with this maxim that assessment drives learning. I personally feel, and this is corroborated by many of the experts and their publications, that we have actually given too much freedom to assessment to drive learning. Actually, it needs to change. And what it needs to do is to actually get rid of this paradigm and move over to a learning drives assessment. If you allow the assessment to drive learning, we will be where we are today, dissatisfied with the way the students learn, dissatisfied with the way they practice. But if you allow learning to drive assessment, then many of these issues can be taken care of. And so, when your program of learning and program of assessment both point to the clinical competence that you have already planned, in our case, for example, the competencies that you have listed. So your program of learning to teach those competencies and your program of assessment to assess those competencies should be in sync. And that is the very concept of programmatic assessment. So what does it mean? What it means is that you have to move away from the modular approach to assessment. Right now we don't distinguish between the context of assessment. For us, assessment is an assessment. You have a question paper, you can use it for class test, you can use it for stand-up, you can use it for university examination. How does that matter? This modular approach takes away the purpose of assessment, and therefore the program of instruction and program of assessment have to be integrated. Unless that integration happens, the learning will never be in the direction where you want it to be. Will always be distorted because of assessment. And such assessments have to be spread over the entire course, because as I've been repeatedly emphasizing, you cannot depend on single assessment to make a high-stake decision. Not only you have to spread it over the entire course, you have to use multiple tools in multiple contexts and aggregate them wisely. The individual data points are used to optimize learning, feedback, and reflections. And an aggregate of data points is used for decision making. So actually, if you look at this, the boundary between formative and summative is lost. So at certain point of time, every assessment is formative, because you are using it for learning, you are using it for feedback, you are using it for reflections. And when you have a collection of such formative assessments, they become summative. So no assessment is purely formative, no assessment is purely summative, depending on the stakes. But all assessments are formative. That's for sure. They become summative only when you have accumulated enough of data points to make educational decisions. So programmatic assessment is an approach to use assessment for learning. It's an approach to optimize educational decision making, to ensure quality in assessment, and most importantly, it's an approach to lower the stress of assessment. Each assessment is not going to be taken for educational decisions. So even if for some reason a student is not able to perform well on one assessment, should not be a cause for stress. It should be available to the student and provide them an opportunity to actually explore, to experiment. And if not able to perform well on one for whatever reasons, they always have an opportunity to perform well on another. Now that is the whole purpose of programmatic assessment. Let's compare the traditional with programmatic. The first important point which stands out is that traditional assessments are modular, whereas programmatic assessments are continuous. In fact, many years ago, 1988, 89 to be precise, I had read a book by Association of Indian Universities on internal assessment, and they had prefixed the word continuous to internal assessment. So throughout that book, the phrase that they used was continuous internal assessment and not just internal assessment. Because as I told you, each assessment point has to be used to provide feedback, has to be used as a learning opportunity. In the traditional assessments, the integration of knowledge, attitudes, and skills is left to the learner. You hope that he will be able to integrate the three domains whenever required. On the other hand, in programmatic, the integration is built into the system. So rather than isolatedly assessing knowledge and skills, you have an integrated assessment, or the phrase that I used earlier, the whole task assessment. And mind you, that even when you are making a whole task assessment, at the back of it, you are still assessing individual knowledge and skills. You are not ignoring that. We are assessing. Only thing is we are assessing in context and providing an opportunity to the student to integrate those three domains together. Traditional assessment happen in the laboratory, wards, whereas programmatic assessments, they happen in the real workplace. Traditional assessments look at the surrogate assessment task, whereas in programmatic assessment, they are the authentic assessment task. And lastly, and the most important, the traditional assessments work on the paradigm of assessment drive learning, whereas programmatic assessment works on the paradigm of learning drives assessment. So what are the characteristics of programmatic assessment? First, that they use multiple instruments to look at the individual strengths and weaknesses. Assessment is a continuous and a longitudinal process. Each assessment is important, but for a different purpose. Information is not collated within instruments, so you don't just keep on adding marks of essays to MCQs to Viva, but you add the marks within domains. So what about the knowledge, skills, and attitudes pertaining to central nervous system, knowledge, skills, and attitudes pertaining to cardiovascular system, and so on. The stakes of decision making are proportional to the richness of data. So for feedback, just one assessment may be enough. For internal assessment, one, you may need 5 or 10 assessments. Whereas for final promotion decision, you may need multiple assessments before you can make a decision regarding the student. The quality assurance is built into the system, and the feedback loop has to be closed. So in other words, no assessment in programmatic assessment happens without feedback, because to fulfill the improved function of assessment, that feedback loop has always to be closed. Now, how do we implement? Wendell Luton in 2015 actually gave a nice plan for implementing programmatic assessment in health professions education. And the steps they have listed is to prepare a plan of assessment using multiple tools, multiple assessments, multiple contexts, multiple tasks, multiple teachers, multiple locations. I'm sure it reminds you of that the Dil Mange More paradigm that we generally talk in assessment. Every competency has to be assessed. You do not make a sample. Everything is assessed. Now, where assessed is a different issue. Some things are assessed in class tests, some things in the internal assessment, something in the university examination, some things during internship. But every competency is assessed. You do not use a surrogate assessment that if he could do A, he would be able to do B also. And you have narratives of acceptable performance. Now, if you look at this, it helps not only the teachers, but it also helps the students to learn. I would request you to have a look at the mini CX form after this talk is over. And at the back of that mini CX forms, you will find the narratives of performance for data gathering, clinical decision making, optimization, and so on. So although it involves expert subjective judgment, It is no longer biased. It is happening according to a plan. And that plan, in the form of narratives, also helps the students to master a performance and helps the teachers to assess that performance in a much better way. Now, as I told earlier, we do not label assessments as formative or summative. Every assessment is formative. Contrast it with conventional system where every assessment is summative. So every assessment is formative, but a combination of formative assessments becomes summative. So for the student, actually speaking, it will not make a difference because for every assessment, he would get feedback, he would get a mentorship support, he would be tutored, he would be coached, because each assessment represents one pixel individually, which does not mean a thing. But when pixels accumulate, they produce a picture. Each assessment represents a point, which is part of the whole. And each point is used for mentoring, feedback, and reflection. Now you have to collect data points commensurate with the stakes of assessment. As I have been telling repeatedly, for class tests, for example, the stakes are very low. For internal assessments, stakes become higher. For promotion to the next professional year, the stakes become even higher. So depending on what kind of stakes are involved, you collect the number of data. Just recall the example of trial in a homicide case. So the police will collect multiple evidences and not just stop at the minimum. Even if their point is proved by 5 evidences, they would still collect 20 pieces of evidence so that everybody is absolutely sure of the decision that is going to be made. Encourage personalized remedial measures for each student, for each task, for each context, and for each teacher. When each teacher is involved, the students get an opportunity to look at different perspectives. They are no longer groomed with the idea that there is only one ultimate truth. They learn that there can be more than one ways of looking at the reality. There can be more than one ways of solving a given problem. Feedback has to be an integral part of assessments, said more often, and this is probably one of the key components of programmatic assessment. So how do you collect all the data points? You have to be in the form of suitable portfolios, hard copies, e-portfolios, and Siraj has already fixed up another session on using e-portfolios. So maybe 2 or 3 weeks down the line, we'll be talking on portfolios in more detail. You also have to train faculty to become effective coaches and mentors. So this mentoring and coaching is very important. And I'll invite my colleague Jyoti to speak on feedback and reflection as far as programmatic assessment is concerned.
Yeah, thank you, sir. Thank you. Sir has adequately and repeatedly stressed the need for feedback in assessment, in learning, and specifically in programmatic assessment. We have heard this repeatedly and read it repeatedly that feedback is said to have a large influence on learning, and this is something which we sort of know by heart. So it is that magic wand that will transform assessment into learning. But is feedback enough? Is just giving feedback adequate? All of us know it, you and I know it, that a lot of feedback is actually ignored. We can think of the times that we've received feedback for many times, and there's no reason to believe why students would be any different. So there would be a tendency, consciously or subconsciously, to ignore a good amount of feedback. So providing feedback does not guarantee its use, and it has to be backed with self-reflection. So like Erickson said, it requires reflection and follow-up. So feedback alone is hardly meaningful unless it is supported with a cushion of reflection and follow-up. Which brings us to, is reflection or self-reflection adequate? Does every learner reflect on feedback even when given optimally? We can train our students to reflect. We've been taught to reflect. It can become a habit, but should it stop at reflection alone? It may just become an exercise. I can be very disciplined about it, that whatever feedback I get, I can reflect upon it and just let it be. So there's something more required, and which is the third point, which is a follow-up. Reflection for the self-reflection is usually not well received, will not translate into learning. A follow-up action in terms of coming up with a plan of improvement. That is why when we talk of feedback, we actually talk of three aspects when a learner needs to know. One, a learner needs to know where he or she is going, that is a feed up, or knowing about the direction to take. How am I going, which is actually the feedback provided, and a plan for progressing on that path, which is the feed forward. When a learner is given a feedback and the person reflects, invariably learners require some soundboarding to know, to clarify thoughts, to go back over what the feedback was, and to come out with a plan of improvement. Now, who can be this soundboard? The soundboard requires presence of a mentor. The mentor could be a peer mentor. The mentor could be a faculty. As faculty, this becomes even more crucial for us in competency-based education. Competency-based education is all about learner support and progression. Programmatic assessment is all about learner support, because we are talking about reducing the stress of assessment, reducing the stakes on individual assessment, and supporting learner behavior by reducing the stress. So mentorship becomes crucial in programmatic assessment. It cannot be delinked from the feedback process. It is an indispensable part of feedback and learner support system. And for this, an environment of trust has to be established. Feedback has to become a habit. Reflection has to become a habit. Environment of mentorship has to be natural, which comes with practice. Ideally speaking, the mentor should not have a role in summative assessment, because then the learner still is under a stress of whether the person can share fully with mentor or not. But this will have to be tempered, or this has to be tempered with in our system, because faculty does have the dual role of both mentorship as well as a role in the summative assessment. So it would be correct to say that feedback and mentoring are actually the backbone of this learner support. The environment that feels safe enough so that the learner is not even afraid to fail and knows that the mentor can support, even make a comeback and be back on the path of progress. This is what will work out. This has to be more individual than as a group. Based on the various aspects of programmatic assessment that we have talked about so far, we've come up with a model of programmatic assessment in the Indian context. And I invite Dr. Rajiv Mahajan to please elaborate on the model and the challenges we foresee in implementation of programmatic assessment. Dr. Rajiv.
Thank you, Dr. Jyoti. As Dr. T.S. sir has earlier explained, how we can implement the programmatic assessment. Now let's ponder over how we can fit in the programmatic assessment as far as our Indian context is concerned. How we can actually adapt this programmatic assessment in India, particularly in this competency-based medical education environment. And I will say this introduction of competency-based undergraduate curriculum actually has provided us a great opportunity to introduce this programmatic assessment. Actually, this programmatic assessment is a need and necessity under competency-based medical undergraduate program. And because in competency-based medical education, what is going to change drastically? It's not teaching which is going to change drastically. It is not learning actually which is going to change drastically. It's assessment which is going to change drastically. And the basic that premise of assessment is feedback. As sir said, that no assessment is assessment without any feedback, and this programmatic assessment provides us opportunity for feedback. As you can see in this slide how we can implement or fit in this in our Indian environment. Every teaching learning, now these are only for representation purposes. Every teaching learning or self-directed uh, this should be followed by formative and ongoing assessment. So every teaching learning opportunity, it should be followed as such by formative and ongoing assessment, and then by feedback, reflection, and remedial measures. This is one block. And we say this feedback, reflection, and remediation, it should happen here only, not only for remediation purposes for the students, but also for feedback to the teachers also. If they want to do any course correction, they can do at this time only, not after university examinations, but here only. And after that, as we say in preclinical and paraclinical subjects, there should be at least 3 internal assessment examinations. And for clinical sides, there should be 2 at least internal assessment examinations per phase. So this is a phase representation. So after that, there should be an internal assessment examination 1. And after that, if needed, we should go back again. Here is again an opportunity for remedial measures. And then the second block, then again second internal assessment. And we are so fascinated with this send up examinations. So third one will be internal assessment or send up examinations. And as sir actually discussed few points, now let's see if this model actually reflects those points also. As I said, we should de-link individual assessments from decision making. So decision we are making at the end from these all internal assessments and all programs. At the end, we are making a decision if student is eligible for university examination or not. And then he appears for university examination. No one assessment is making any decision. So we are de-linking individual assessments from decision making, and individual assessments or individual data points, actually they are being used for this feedback, reflection, remedial measures, for mentoring, and for reflections. As it was said that assessment without feedback is no assessment, and as Dr. Jyoti said, feedback without reflection is no feedback, and reflection or self-reflection then should be followed with a remedial measure also, or with some action also. And this whole thing, this whole block, actually this mentoring should be continuous business. As Dr. Jyoti, he emphasized that mentoring should be continuous, and this is not only for first year, this is for all the years. This is a represent of one phase, so this mentoring will go on for what we say this reflection purposes, for feedback, and for remedial measures. So as sir said, when we will start using it, this programmatic assessment will be internalized. Then these boundaries between this teaching learning opportunities and these formative and ongoing assessments, they will also blur. these boundaries will become ill-defined, and ultimately the program of instructions and the program of assessment, they will integrate. So that is the whole purpose of programmatic assessments, and that's how we can actually fit in it in our competency based medical education program. But this is not an easy process. This implementing programmatic assessment, it will have its challenges, as is there with any change we do. So initially it will require a lot of planning, lot of efforts are to be built in, and it will require a lot of time. Initially, I'm saying, as the things will internalize, as it will become automated process, then maybe we will be somewhat relieved, but still it will require planning and efforts. Then there will be paradigm shift from, say, modular to the programmatic assessment. And this shift is never without any resistance. So that will be there, and it will be a challenging job. Then stakeholders, they should actually buy in, and it makes all stakeholders to buy in, all like students, teachers, administrators, even people, because in this programmatic assessment, the individual data point collection will be at many points. So people may say there are so many tests or there are so many assessments are involved. They will be there. So all stakeholders, they need to buy in this programmatic assessment. And as we all know, getting good feedback itself is challenging. Feedback from the students and students getting feedback from the teachers, both are challenging jobs in itself. And this whole premise of programmatic assessment, actually it is built around this feedback, formative assessments, reflection, self-reflections, and remediations. So that itself is a challenging job. And another challenge, but still I will say that we can, if we try, we should make a start, even if we are able to implement it partially. As we see that if we ask someone, uh, do you do problem based learning in your colleges, everyone will say yes. But do they do it as per rules, as per principles? I will say no. But still they are doing it, and they are having some benefits of it. So in the same way, if we start implementing it, even though it might be partially implemented, still we will have some possible partial benefits, and these benefits, they will be proportional to the level of implement of programmatic assessment. Up to what level we'll be able to implement programmatic assessments, same will be the benefits for us. So do implement, do make a start. And for that, I will again invite TS sir to have a concluding remarks.
Thank you, Rajiv. If we look at the global experiences, the early results of programmatic assessment have been very encouraging. 2 days ago, I had a chat with Lambert Schubert, the person who actually came out with the model along with Wendell Luton. And he was very convinced that for competency-based medical education, nothing short of programmatic assessment will work. If we want CBME to succeed, we have to have a system of programmatic assessment in place. And as Rajiv said, that like PBL, it's not necessary that we should have the classical form implemented everywhere. To the extent possible that we can work on this. And I don't see much difficulty in implementing programmatic assessment within the current system. The new regulations for assessment which have come actually provide a lot of opportunities for us to implement many of the concepts, to use each assessment for feedback. It should not be very difficult. And aggregation of assessments to be used for high stake decision making. Research has also shown that when you use programmatic assessment, students actually become feedback seekers. As of now, I would be little skeptical to say that students would actively want to get feedback. But with programmatic assessment, a shift has been noted. It has also been seen to promote self-directed learning, which would be very useful, especially with the very short half-life of knowledge and rapid changes that have been happening. But of course, all this requires more research. It's been about 25 years that people are working on it. and things are becoming much more clearer now than what were they some time ago. So before I conclude, let me summarize the basic principles of programmatic assessment. All that we discussed in this last 1 hour or so has been put up in this diagram. I would only like to highlight the important aspects. One is to use multiple methods, multiple tools, multiple teachers, multiple contexts, multiple situations to delink assessment decision and assessment point. Use lot of formative assessment with feedback. You use expert subjective judgment rather than going after only highly objective or so-called reliable methods, and triangulate the results of assessment with other assessment data. Multiple source feedback, for example, workplace-based assessment, for example. So if you use all this together, there's no reason why we should not be able to implement programmatic assessment within the given MCI directives. In fact, I see it as a great opportunity that having clarified the logistics of internal assessment, actually they have provided you an opportunity to really apply some of these principles. I would have found it difficult maybe with the old system which is currently in vogue, but with the new batch and with the new system of formative and internal assessment being laid down, it should be really possible for all of us to look at programmatic assessment and to apply it to the extent possible. So thank you very much for being with us, and I'll be happy to answer any questions that you have.
Raise your hands while Dr. Supe sir, would you like to make a comment? Dr. Avinash Supe. Sir, he has written programmatic assessment is a very good concept, but I think he's not able to speak. Any hands, please? Raise your hands. Yes, Dr. Meenu Pandit Rao.
Hello, this is a very good session. We were reminded of many drawbacks that we had and how to improve them and how to make the proper assessment, not based on only the like in the traditional method. We are not covering the whole thing, the whole scenario. So here we can make the proper judgment considering the whole scenario. Thank you so much.
Dr. Anshu.
Thank you, sir, for a very thought-provoking session. One of the complaints about the present system of assessment, which has just come in, is that you have a lot of internal assessments, and as you know, students disappear every time that an assessment is announced, and we lose 15 days to 1 month just because of the exams and the preparation in an already cramped curriculum. So in the future, given this programmatic assessment, do you visualize a day when we don't have an internal assessment 1 or internal assessment 2, and all we have is multiple data point collection of marks toward what we do every day? And I think it will reduce the stress that students have thinking about that exam. So when you're going to be assessed every day or maybe every week, so you're prepared for whatever comes by and you're more regular.
Yeah, I agree with you, Anshu. That is what actually should be happening. But short of that, even with the present system, in fact, the opportunities that have been given to us are much more than what were available for the last batch. And I think we should work on it as Rajiv said, that a lot of stakeholder suddenly people will not kind of uh, go with the idea that nothing have to be told, students have to be told, society has to be told. So a whole lot of paradigm shift has to happen. But ultimately, yes, we probably will need to end up at a point where there will be no designated formal internal assessment. Everything will be a data point, and you pick up some points out of that to make a decision.
Thank you, sir.
Students and less number of staff, what are the various ways by which you manage?
Well, see, once the stakes are lowered, then you can use even your residents and senior residents for assessment, because individual assessments are not going to make a difference as far as you have to use it only for the purpose of providing feedback and reflections and remedial learning and so on. So that is one way of doing it. And I would like to refer back to our paper on quarter model, which me, Anshu, Jyoti, and Piyush had published. And there we had given a plan that within the existing MCI system of the staff which is recommended, how can you distribute the staff for each of the assessments and still make it a valid and reliable assessment. I don't think we can really go on that because I don't have the presentation of that with me at this point. But if you Google quarter model with my name, I'm sure you would get a paper where all these things have been deliberated.
Dr. Malati Ponuru, what should the students know about giving feedback?
Sorry, I couldn't hear that. Say that again.
What should the students know about giving feedback? Can we request the students to post feedback?
Jyoti, will you like to answer?
Yeah, I heard only a part of the. Would the students like to give feedback? Is that what you said, Dr. Bedi?
Yes. Dr. Malati Ponru. Let me see if we.
Yeah.
Yes, Dr. Malathi, can you unmute yourself and explain this question?
Hello, sir. I'm Dr. Malti from Hyderabad.
Yes.
Yeah. Hi, Dr. Malti.
Yeah, I have posted few questions. Wonderful explanation by all three of you, sir. I'm listening for the first time, participating for the first time.
Yeah. We lost you. You lost you, Dr. Malti, again. Can you come to the question, please?
Yeah, regarding the feedback, actually, they say the students also need to know something about the feedback. So what are the points the students need to understand before giving the feedback?
Okay. So as teachers or as faculty, our duty is not just how to learn to give a feedback, but we also need to sensitize the students how to receive the feedback. So both the giver and the receiver have to be sensitized. And yes, you did mention about can students give feedback to each other? Yes, that can be encouraged, and that will be a training in establishing an environment of giving and receiving feedback. But sensitization and guidance has to be there. So students have to be sensitized for establishing an environment of. So when we say establish an environment, it involves giving. There should be a culture of giving feedback. There should be an environment of trust, which should have safety, where the givers and receivers know the optimal ways of giving and receiving and the follow-up action. So it encompasses all of that. So feedback is a small bird, but it includes a lot. Thank you.
Thank you so much.
Dr. Balachandra Adkoli.
Hello, am I audible?
Anji sir, please carry on.
Yeah, first of all, congratulations. After a long time, I was listening to TS and he started with the very good link with the feedback, and Jyoti caught up with the feedback, combined reflection, and then of course Mahajan added mentoring. The 4 bits have really completed the story. Congratulations. And Jyoti also mentioned repeatedly what I have been telling, the need for making a culture of feedback, which is extremely important, because our students are not used to give or take feedback. There is a problem. And our mentors are not tuned to read the level of the students and to encourage them, listen them, and to avoid that barrier, that distance between the teacher and the student, which is extremely important. I think unless you dissolve this distance, you will not get a very true picture of what students want to tell. Having said that, TSR, I wish that next time you could also address the university examination, how to improve the quality, because the proof of the pudding lies in eating, isn't it? So I can say that if you can put up a robust system of internal assessment, the system will take care. But unless we also address summative assessment at the end, our intervention remains incomplete, because that is what the reflection of the ultimate quality. Thank you very much.
I find Vivek is there in the audience. Vivek, can you please address this issue?
Yes, sir. Dr. Vivek Sahu. Sir, please unmute yourself. Dr. Sahuji, can you unmute yourself?
Yeah. Can you hear me?
Yes.
Yeah. So excellent presentation, all 3 of you, Tejinder, Jyoti, and Rajiv. I think it was an eye opener and really a new way to go forward as far as assessments is concerned. And as has been emphasized and overemphasized, the need for feedback, I think that's the key to success. And we really need to come up with simple models of giving and receiving feedback. We are having mentorship programs in our universities, but again, these mentorship programs mainly exist on paper, or maybe just, I think, to maybe fulfill some regulatory or accreditation requirements. So I think if we are able to make these mentorship programs little robust, and if we start, I mean, since we are all think tank, and I think Jyoti, you've been publishing widely, so maybe making the feedback little simpler way in which the students would receive it, the faculty, it's not a burden, and I think it should not be a sort of a okay, I mean, I have to give feedback or I have to receive a feedback. So it should not be a sort of a challenging environment. So if we can make it little simpler, and to begin with, we can give some models, I think that will help in making this programmatic assessment successful. But nevertheless, a wonderful presentation. Really appreciate you all. Thank you.
Thank
Dr.
you, sir.
Chetna Desai.
Sir, thank you. Thank you, dear sir, as well as Jyoti and Dr. Rajiv. Nice session. Sir, my questions relates a little bit to what Dr. Adkoli mentioned. I was thinking, since we have so much, quite some weightage on internal assessment, formative assessment in the new curriculum, we are finding it a bit difficult to, have several assessments along with summative assessment. How would it sound if we simply do away with the summative assessment totally? If we can make a formative assessment more robust, change its structure, have some external examiners coming for some of these formative assessments, and completely do away with the summative assessment, is it possible?
That's a very provocative statement. Personally,
I know it is, but we spend so much of time, money, resources on this summative assessments. That's why.
Personally, I strongly agree with you. And if
Yes,
I
sir.
ever get an opportunity to be in that position, I would actually do away with the university examinations. Now, having said that, it is that it is not doing away the university examination. The role has to change.
Yes.
Where do you certify competencies? You can never certify the competencies in the university.
Exactly.
So many 5,000 competencies, where do you certify? Not in the university examination. That's simply not possible. That has to be done in the institution, in the classroom. So when everything has to be certified there, then the role of university examination should be like a quality control. They should be sampling few representative competencies and assessing them to decide whether the student should pass or should not. Rather than putting so much effort into the university examination, I would want the universities to actually pay as much attention to formative assessment. Right now the formative assessment is totally within the college's domain. Let universities guide them, let them work, let them make out a plan of formative assessment. What could be formative assessment? That is what we require.
Yeah, so that is what I meant when I said that we should restructure the entire formative assessment, taking
ultimately to happen.
Yes.
It has to happen.
It has to happen.
Can I add a bit on this?
Sure.
Yeah. So with a primary disclaimer that we cannot mess around with the university examinations under the system, but just wanted to share with the participants that the original model, the actual model, when we say non-hybrid programmatic assessment, and so this is like in response to what Dr. Anshu also said, if we could do away with those 3 IAs and have only dots which add up to a picture, or Dr. Kohli said we have do away with university. Yes, programmatic assessment says that the final summative high stakes decision is taken by a committee, which takes an overall view of all those dots along the training. So actually in true programmatic or pure programmatic assessment, the summative decision is that of a committee. The mentors are not a part of that committee. And e-portfolios are a very strong way which become a media of this assessment. So yes, we are that far from reaching the ideals. So just for sharing, thank you.
But short of that, Jyoti, back to what you have said, short of that, let's not wait for that ideal situation to come. Whatever we can do, whatever implementation we can do, even if it is piecemeal, doesn't matter. We may not get full benefits. We'll get only piecemeal benefits. Doesn't matter. But it will still be better than what we are doing as of now.
Yeah. All of formative is for us to explore and improve.
Doctor, sir, may I add something for university examinations as far as is concerned?
Yes.
Hello.
Please speak.
Carry on.
Sir, even in India, under university grant commissions, under a choice-based credit system, although that is altogether different from a programmatic assessment which we are discussing, but under choice-based credit system, they have done away with the final university examinations. It is totally an internal matter. So that's how our final decision is also taken. And that is not only for undergraduate programs, but also for postgraduate programs under choice-based credit system, and they are implemented in many programs.
Dr. Ravindra Namdar. Dr. Ravindra Namdar, Dr. Praveen Singh.
Hello, sir. I'm Dr. Namdar.
Yes, please speak. Yes.
Excellent session. I would say it is a revolutionary idea. I have 3 points. Please note. Number 1, please give the list of references that will help. Number 2, the proposed model of programmatic assessment, although there are various dots, ultimately they converge to only eligibility level. University examination remains still the robust one, summative examination, which decides percentage passed fail. So all these points would only go to a 50% eligibility level. Number 3, we have teaching learning. We have to give time for the students to study, and we also expect all the competencies to be covered: domains, context, feedback, reflection, mentoring, tutoring. Uh, and when these are the dots to be collated, student would look at every dot as an examination, and whole thing will put a stress, and there would be a time constraint for all these activities. Please comment.
Dr. Praveen?
हाँ था हाँ yes sir thank you for a very good presentation yourself and Jyoti and Rajiv. I just had one question, sir. Probably the question, I mean, from the presentation which went on, you said that all the competencies, all of them need to be assessed at some point of time in the internal assessment or in the formative assessment as a part of programmatic assessment. Just one point. I mean, do we need to assess them all because some of the subjects are having many competencies in the new uploaded curriculum? So, do we need to assess them all, or still they can have some sampling?
There is a lot of content specificity. So doing
Yes,
one
sir.
competency well does not translate into doing another competency also well. So therefore, in a pure situation, you would assess all competencies at whatever point of time. Need not be all at university examination or need not be all at. See, the thing is that when you are issuing a certificate saying that this student is competent as per our document, then you have
Yes,
not,
sir.
and if you have not assessed half of them, then it makes little sense actually to say that you are following a competency-based model.
Yes, sir. But I was just checking the
So,
feasibility part, sir. Some of the subjects are having many competencies. So can they
no,
sample some of? No. Okay, sir.
so what I would say is that we need to have a relook at the list of competencies.
Yes. Yes,
Many
sir.
of them can be clubbed together. Many of them,
Fine.
for example, are spread over different subject areas, and some of them might be even repetition. So that should be taken care of. But this is very sure that if you are certifying a student to be competent based on the list of competencies, you cannot do
Yes, sir.
so by certifying only 50% of them and remaining 50 to be taken as being competent. That probably will not work, not in my opinion.
Yes, sir. Sure, sir. Thank you,
And
sir.
sir, to add to that, many competencies are like that. You will need only one question to assess them only.
And
Dr.
to Dr. Inamdar's comment on again university and formative, I think we just need to go back to what Dr. Rajiv had reiterated, that even problem-based learning, we don't have to do an all or none. We have to do all that can be improved in the present. So we try and focus on everything that can be improved towards the betterment, and not wait till we do it 100%.
Dr. Satnam Singh? Dr. Srinivas? Dr. Srinivas? Dr. Suhas?
Hello, sir.
Yes.
Is my voice audible, sir?
Yes.
Yeah. Thank you, sir. It was a wonderful lecture. I have two questions, sir. How to maintain uniformity in formative assessment throughout the country? Because if you are not maintaining uniformity, again, it will be lead to a lot of bias. And who will be in the committee of decision making for this high-stake exams, sir?
See, as of now, given our present system, I don't think we are ready for that typical or classical model. What Jyoti said, that there has to be a committee to decide on high stakes and all that. Right now, we don't have that system in
Yes, sir.
place. You still have to follow the university examinations pattern because that is what the system is.
Okay.
The medical council can only tell about
Yes,
its
sir.
role. It cannot really force universities to do and adopt certain procedures. They have to follow their own guidelines. So what I suggest, and which has been repeatedly emphasized, that don't go with all or none phenomena. Whatever we can do, at least few of the things which you can do is that all assessment must be followed by a feedback and mentoring and reflection. I'm sure that can be done. I think prevents us from
Okay,
doing that. Have a meaningful combination, have a assessment of the same system on knowledge, skills, attitudes, and then combine the marks. That can be done. So that way, let's start working on it. It's not that tomorrow we'll just overthrow the whole system and come out with a new one. That may not happen because stakeholder buy-in is very important.
yes,
People have to be convinced about the utility of this. No? See, ultimately now when they go out with university degree with whatever the worth of the examinations, at least it is a university degree. Now tomorrow you say that there is no university and only a committee has decided to pass or fail, then acceptability and other issues might be there. So we have to prepare
true, sir.
concept, we have to prepare people, we have to prepare stakeholders before we can go for a full-fledged programmatic. But short of that, whatever we
Yes.
can introduce, let's do.
Thank you, sir. It was great listening from you.
Dr. Mithila Dayavanti. Dayanthi.
Very good presentation. Sir, I have a few questions. One is, my question is, I'm trying to figure out about the assessment part. How are we going to change from learning is going to drive assessment? Because in our education system so far, we have been having a system of only assessment driving learning from first standard till 12th standard. So how are we going to do that? Because unless we have we give a test, the students are not wanting to learn. After I get a response of this, I'll go to the next question, or should I ask the next questions now?
I'll respond. In fact, what
Yes, sir.
you said is very, very relevant. So when I
Sure.
say that we move over from assessment drive learnings to learning drives assessment, I do not
Sure.
mean that we do away with the test. You are
Hmm.
very right that unless you give a test, the students will not learn. And there's a lot of research to say that whenever you give tests, the students' learning always improves. What I mean by saying that do not let assessment drive learning overshadow the whole thing is that do not have questions which have nothing to do with the actual requirements of the students. Please
Okay.
assess them on competencies which they are actually going to perform when they go out to practice. That is not difficult. That we can do. For that, no change is required. I'll give you a common example. I don't know if it happens now or not, but when I was a student, for example, I'm talking way back 70s or early 80s, we were taught, for example, carcinoma cervix in OB-GYN for 1 week, with including radiotherapy and radical hysterectomy and so on and so on. Till now, after 30, 35 years of having read that, not a single day I needed to put anything of that sort into practice. So that is where the problem comes. When your question paper asks me to write an essay on carcinoma cervix, then I would rather learn about carcinoma cervix theoretically rather than learning how to conduct a normal delivery. That is what I mean, that your learning should drive assessment. You first decide what you want them to learn and then assess accordingly. Not that you assess them and then let them make interpretations and meanings out of that. I hope that clarifies your point.
So according to the syllabus, we need to understand what we want them to know and then do the assessment.
Exactly.
Okay. Oh, okay. Second point is regarding the feedback. Sir, actually, I am not in the power position of being the professor or the head. Right now, I'm an associate. My point is, I am very much wanting to give feedback to the students regarding their performance, but my higher authorities or the persons who are in the position to give an internal assessment are not wanting to give the feedback. Neither my higher authority is the head of the institution very keen of the feedback. So I request you people who are there in the guideline positions to make a guideline that feedback needs to be done every month, every 3 months, like from the dean, the departments, she or he should seek feedbacks regarding the assessments of the students, because giving feedback is not an important issue mostly taken up by the faculty, sir. But I feel it is an important, very important aspect, so that the student can know where is their gap. Why are they not able to perform? I think Dr. Jyoti might be able to give me a highlight about it.
I'll hand over to Jyoti, but before that, let me say, you again actually said the same point in a different words, and that is what you said, that it should be learning which should drive assessment. Because they need to know where what they need, they should be able to do. They know what are the shortcomings between what they know and what they should be able to know, and thirdly, what they should do to bridge that gap. That's what exactly the feedback.
Sorry to interrupt you, sir. Actually, I want to give feedbacks, but if I want to gather the students to bring them in batches of few, 5 or 10, my heads or nobody want me to do that. So how do I get away with that obstacle? Because then it becomes an individual response. I call them, I WhatsApp them, I specifically call them. So I want them to improve, because when I want to do it, there are so many obstacles. My head is not allowing, or my institution is not, institution head is not very keen on giving feedback. So how do we go by? Because feedback is very important.
So you can continue using WhatsApp actually. A lot of feedback can be in the groups. There are common mistakes, common issues, common problems. So you can address all that at one go for a group of students. For example, if you have a WhatsApp group of 50 students and I'm giving a clinical example, for example, that when you find that when the students were examining a patient, they were standing on the left side rather than on the right side. Now, this is a thing which is common to all the students, and that can be given as a common feedback. Now, then come the individual points. For that, you can actually pick up the performance issues and then tell the students. But as you said yourself, WhatsApp can be a very useful medium to provide feedback to the students. And I don't think anybody would say that don't give feedback. The only thing is it might clash with class timings, etc.
Sir, they are not expliciting saying don't give feedback. जरूरत नहीं है. क्या जरूरत है? क्यों time waste कर रहे हो? ये आता है sir response.
Madam, इसमें ना my philosophy is very simple. As long as they do not say do not do this, you can keep on doing that.
Okay. So I have.
I would just add on. Madam, there are two aspects you said, and you have given the answer yourself. One is you want to, and two is whether a regulation can be said. And actually, the more important part is whether we as faculty want to. Unless we want to, the regulations will become mere exercise. If feedback is enforced by 3 feedback exercises in a semester or 6, then it would limit to that and probably just a paperwork and some. What is more meaningful is your feeling as a faculty that you want to give a feedback, the students deserve a feedback, and it can be a small act of correcting which side they are standing. When they are presenting to you, the feedback can be continuous. The feedback doesn't have to be an announced event. When it is an announced event, it is not really a habit. Feedback has to be habitual and continuous, like assessment has to be continuous. So a classic example is our clinics, where you watch a student examining and at the same time you're giving a feedback, and then soon after you can talk to that student and tell the student further things that you would not have wanted to mention on the bedside. So my take is, I think the more important part is already in place with you.
Oh, okay. I have one more question on mentor.
Ma'am,
actually, sir,
before that I have, excuse me, ma'am, before that I have one question for you. Do you evaluate question papers? Do you check question papers, answer sheets of your students, like in class test or any other answer sheets?
Yes, sir.
You test, you do evaluate,
yes,
huh?
sir. Yes, sir.
Have you ever used that opportunity for giving feedback to students?
Yes, sir. I always actually what we I will tell a little about the process in which how we are assessing. The question
So
paper
if you
is
are using that opportunity for giving feedback to the students, that will automatically convert into one-to-one feedback.
Sir, that is
They
what
will automatically come to you.
Yes, sir. That is what I want to say. When we have assessed the question paper, when I tell my head that we need to take out little time, if there's a tutorial hour, let us take out 1 hour to just give them a feedback. So they said, "Jarurat nahi hai, kyun time
Ma'am,
waste
I'm
kar rahe ho?"
saying use that question paper, that answer sheet itself for giving written feedback to the students. You can give there also, there itself, and when you will distribute back it to the students, they will come to you
So
themselves.
even distribution
One to
is
one.
not done, sir. Even distribution is not done. That is what my irony
Done
is.
that.
My pain is that only.
Hmm.
Even students who don't know
Okay,
why
go
are
ahead.
they
Then
getting
go ahead
4
with
out
your
of
next question.
yes, sir. Sir, regarding mentors, there is no strict guideline who has to be the mentor. Usually, what happens is because, sir, I am the medical educational. Irony is, I am an associate in the community medicine department. I am the medical educational coordinator of my college, but unable to do many things. So, the mentor which is selected for the student is the internal the summative assessment internal formative assessment subject teacher. So the students are not able to freely open up with the faculty regarding their problems. So this has to be changing, sir. There is no guideline regarding who should be the mentor, who should not be the mentor, because when it is the examiner teacher, examination subject teacher, they are not going to come up with their problems. And we are facing a lot of problems because the students are transitioning from 12th standard to the medical college. So they are facing a lot of problems which we are not able to do, sir. So if there is a guideline regarding mentorship, this teacher should be and should not be the mentor for this semester, that will be good, sir. I have one more question. If I get a response on this, then I'll go ahead to the next one, sir.
Actually, there are 20 more people who are raised hands.
Sir,
So-
then I will ask my last question regarding university exams, sir. Since we are having the first semester exam, which is going to come up now as based on the 2019 CBME, sir, there is no particular guideline which has been given to this. My college comes under CCSU, Chaudhry Charan Singh University. So there is no guideline. Our teachers are clueless about what is going to be the examination pattern. So if there is a guideline which is distributed to even the universities, then it will be helping us take a pre-university exam.
Ma'am, it's put up on the MCI website. There is a whole
Yes, sir.
module on assessment for competency-based medical education. You can
I have
download
gone
it.
through it, sir. I have gone through it. I am afraid whether the university is also following the same thing, sir.
So they have to follow. There's no way they cannot.
Okay, sir. Okay.
They have to follow that because that is mandatory on the part of universities. So if
Okay.
you feel that they have not read it or not received it, I suggest you download it and forward it to people who matter. Send it to the controller of exams, send it to the registrar. Let them have a look
Okay.
at it.
Okay, sir. Okay, sir.
But they have
Okay.
to follow it. There's no way they can not follow it.
Okay, sir. Okay.
Dr. Srinivas has written on chat what the controller of examinations can do for implementation of programmatic assessment.
I also got the same question from Dr. Pramod Goyal, who is also controller of examination. And I'm glad that this question has come up. In fact, if you look at it, controller of exam, there's another saying actually, very popular saying about assessment, that one who controls assessment controls the program. So as a controller of examination, you can give a lot of direction to the way the students are assessed and the way they learn. Unfortunately, for most of the universities, the controller of examination actually becomes a glorified clerk who has to simply send the papers to somebody and get the marks and total up the results and so on. So he hardly actually plans the examination. So what I suggest is that controller of examination, along with the registrar and maybe the vice chancellors, they can actually sit down together. They can discuss out what kind of assessment should be happening. The question papers need to be moderated. You have a assessment guideline from MCI put up on their site. Download that, read it into your system. Let every teacher be aware of it. I'm sure as a controller of examination, you can play a very significant role in improving the quality of assessment.
Yes, it was Dr. Pramod itself. It was not Srinivas at my end. Yes. Dr. Shiba Kunju. Dr. Shiba?
Yes,
Dr.
sir.
Sheetal Joshi.
You are able to hear
Yes,
me,
please.
sir?
Yes, we can hear
sir,
you.
actually, you are able to hear me?
Yes.
Sir, actually, I am working as a clinical core faculty in OBG in Ras Al Khaimah Medical College. So really, today's talk was very informative and it was very good. So when they were talking about the programmatic assessment, in our college, what they do is that, sir, they have an ICA, that is ICA 1 internal assessment. From that, 20% of the marks will be taken for the final 100%. Then ICA 2 we have, out of that we will take another 20%. Then we have team-based learning. Each subject we will have 2 team-based learning that will contribute to 10%. Then we will have clinical decision-making quizzes that will contribute to yet another 10%. So 60% will be like over a period of whole academic year. Only final exam will carry only 40%. So what happens is that, sir, all the students, they have to study throughout the academic year. Like back in India, when I was studying, maybe we all will read towards the end for the final exam. Here it is like you have to study then and there, because each of your assessment will taken for your final 100%. So I think programmatic assessment, when we follow, students will be learning throughout the academic time. So it's a very good, very good idea, sir. I think that will help more of learning.
Yeah, thank you for reinforcing that point. In fact, one of the advantages of having a, and I use the term continuous internal assessment, is this only.
Yeah.
That the students will be studying throughout the year rather than studying
Yeah.
only 1 month, 2 months before the exam.
And here again, sir, it is the assessment which drives the learning, because they team-based learning, if they don't come, they will lose 10% of that marks. So they make sure that all of them are there for both the team-based learning sessions. And again, clinical decision making, definitely they will be there because it will contribute to another 10%. But final exam carries only 40% marks. 60% you would have earned before itself, sir. So throughout they will be learning. Thank you, sir. Thank you.
Dr. Joseph Raj.
Oh, yeah. Good evening. At last, I got a chance to speak. Now, the whole concept of programmatic assessment is good, but the only problem is like Sir mentioned, 3 points: validity, reliability, and feasibility. Will it be feasible in a large country like ours, where the system and the teaching modalities are so different? The second point is that will there be any this kind of an assessment where competency is based for postgraduate education?
I'll start answering your second question first. MCI has already given a list of competencies for most of the postgraduate departments. Unfortunately, what happens is that we approach competency assessment like conventional assessment, and that is where the problem actually starts. This is not the time really to discuss about competency-based assessment, but if you are making a competency-based assessment, then guidelines for that in each subject are already there on the MCI website. I think you can download it, have it discussed in your departments, and you'll get a lot of new ideas. Coming back to your first question, see, right now also we are assessing. All that we are saying is that if you are putting in an effort, put it in a better way. That's all. Whatever extent you can use it, please use it. I'm not asking everybody to go in for the classical form where every assessment is programmatic. May not happen, may not be possible because of various reasons. But to the extent possible, let's do it.
Now, the question is there any study done in any other institution where this programmatic assessment has been studied?
Plenty. Plenty of them.
Now, in our country?
No, not in our country, the concept only is not there. So what studies will be done? The programmatic assessment is just beginning to be heard in our country. So you won't find any study from India. But you Google programmatic assessment, efficacy of programmatic assessment, you'll find hundreds of studies available, plenty of them.
Okay, thank you.
Sanjay Mehta, please unmute yourself.
Hello. Hello.
Please carry on.
You can,
Please.
yes, yes.
Yes, sir. It was a very good session. My question is that I think it is exactly contrary to the earlier participant who asked a question. In CBME, I think there is a lot about what we can say day-to-day assessment, right? And the problem is that day-to-day assessment is not given that much of a weightage in a summative assessment. And there is a change. I think there is too much of variability among the university. I think one of the participants said that their university is giving too much 60% weightage to the day-to-day type of thing, while we are not having. So, yeah.
That is not from India.
So, hello.
That is not from India. So actually, that's not a good example.
Okay. So I think should there be a uniformity among the such type of guideline that there should be some weightage of day-to-day assessment in university summative assessment?
Yeah, it is there. You download the internal assessment guidelines from the NCI website. They have described all the formality, all the processes, and how it should be done, what should be the weightage, what should be the type of questions, and all that. It's already put up on the NCI.
It's there, but university does not allow any flexibility about that. That is the problem.
It's only 8 months or 9 months since this new new curriculum has actually come into operation. Give them some time. They will also take some time they have to change their own rules. They have to change their statutes. They have to change their regulations. So it's going to take time, and I'm sure most of them will do it.
Okay, sir. It was a nice presentation, and I really enjoyed. Thank you, sir.
Dr. Tanushri Mondal, can online assessments be included and considered as internal assessments and included in program assessment?
Yeah, I can't get the question right.
The question is, can online assessments be included and considered as internal assessment and included in program assessment?
If you are taking online classes, then surely please supplement it up with online assessment. Use it for the purpose, but tell the students beforehand whether you are going to use it or not going to use it. I mean, it shouldn't come to them as a surprise.
Sir, actually, many things are possible in online assessment that the problem of large volumes can be taken care of, which may not be taken care of in maybe in the class test or something. I mean, maybe this could be one possibility. Then
Yes,
Dr. Yes.
Carry on, Sajid.
Dr. Tejinder Singh, please unmute yourself. After that, Dr. Himangini Shah. Dr. Himangini, please speak. Dr. Archana Dambal.
Am I audible?
Please. Yes.
Yeah.
Dr. Archana.
Sir. Yes, sir. Sir, I have two questions. The first one that I want to ask is about this. We have a still subject-centered, competency-based educational program, which is implemented since the last August. And in this, we are intending by this webinar to implement a programmatic assessment, which is well woven into our PG programs, PG residency programs. So, is it really possible that we weave programmatic assessment, which requires integration of so many aspects of learning in our subject compartmentalized present curriculum?
Yes, it should be, because although we say that it is subject-based competency, but I'm sure you have seen a lot of integration, alignment, and other things happening. So it's not always, and if you have read that competency booklet, in the first few pages, there are examples given how you can have an assessment to test different subjects at the one go. So I'm sure all those things can be done. It does not mean that if it is subject-based competency, we cannot have a programmatic assessment. We can very well do it. As you said that at PG level it is being done. So if it is being done there, then why it should not be able to be done at the UG level?
Because our program is still not a student doctor program, just as we
It is.
have a student nurse
Ma'am, it is.
program.
No, it is. In fact, now for the SIS 2 which is coming, the Curriculum Implementation Support Program. So in that, one of the topics is student doctor method of teaching. Our
Yes,
whole
the
program from 2019 is actually student doctor method. We have not
The
used the
clerkship.
term clerkship. We have used the term student doctor, and you would be hearing more of it shortly now.
Okay, sir. Okay, sir. My second question is something whether I have missed the SLOs or overview of this talk, because initially my audio was not clear. I was having difficulty in connecting to the webinar. So if I could have that, I would go and read up about it.
You can get the recording.
In the first introductory mail which was sent out for joining this
The
webinar, we had listed out the objectives and what we are going to talk and discuss. You can get a
Okay, sir.
fairly good idea from it.
If you could also have shared a few relevant articles, it would have really helped me. For the next seminar, this could help me a lot, sir. Some material beforehand that I could read and then come and attend this big program.
Okay, I think Siraj, if you are there, can you make note of this? Siraj?
Yes, Siraj is,
so please make note that if it is possible that in future we can request the speakers.
And it was a nice program. Thank you so much.
Dr. Srinivas. Dr. Srinivas. Please speak. Sir, we cannot hear you. There is some problem in your mic. Sushmita Sarkar, what should be an ideal student mentor ratio to give just time for each student?
No, I don't think there is any ratio for student mentor relationship. It all depends on what model of mentoring you are using. If you are using one-to-one model, then maybe one teacher can handle, say, about 10 to 15 students. On the other hand, if you are using task-based mentorship, then there is no problem. The student will come to me only for that particular task. So I can cater to many more. Depends actually which model you are adopting in your institute.
What would be the mechanism of keeping a record of learning trajectory of all the students or all the competencies in programmatic assessment in our system? How do we plan with present teacher ratio for medical drivers, especially with respect to feedback and mentoring? Dr. Kailash Charokar.
So next time when we talk about e-portfolios, we'll be dealing with many of these aspects about record keeping and how can we make an optimum use of this. So I think hold on for the next session, and that we'll talk about portfolios and e-portfolios to keep a record of all the learning that is happening. I can see Siraj there.
Siraj is not. Siraj has left.
Oh, here.
Dr. Srinivas has written because the paradigm shift in learning drives assessment, but it also requires a cultural shift and an environmental shift too.
I am not able to hear.
He has given a comment that there is a paradigm shift which requires a cultural shift and environmental shift. Maybe the learning environment.
Yes, Rajiv talked about stakeholder buy-in. So that is where you need a lot of changes happening, not only in the way we teach, but the educational environment in an institution, which would have a lot of bearing on how we assess students, how we give feedback, and how they receive feedback.
Okay. Dr. Mithila Dayanithi. And Dr. Anil Kapoor. Dr. Anil Kapoor.
Hello, sir. Can you hear me, sir?
Yes.
Please go ahead.
Thank you, sir. It was a nice presentation, sir. I just wanted to add a comment on the discussion what one of the speaker has asked regarding how they can give feedback when there is no environment of giving feedback. So I just given a suggestion that when the exams are over, we can give model answers, write down model answers for the questions which have been asked, and we can pass it to students. They can go through those answers and do self-assessment. It would be a good way of giving feedback after the exams. And as Jyoti ma'am has already rightly said, feedback should be given continuously and whenever at the earliest, rather than waiting and announcing that today we will give feedback. This is a small comment. Thank you, sir.
Thank you. Thank you.
Right.
Dr. Kiran Goswami. Very much right. Feedback is ongoing and continuous. We can't have a formal session of feedback except when they come and see, usually with concerned parents. This is also a comment. Dr. Archana says, in our competency-based UG curriculum, which is still subject-centered, how can programmatic assessment as in residency assessment work?
I think we have already addressed this question earlier.
Sir, already answered this.
Yes. Siraj is there. Yes, Siraj, I have unmuted you. Siraj, can you you are self-muted? Please unmute yourself. Siraj. Okay, sir. Himangini Shah is asking, should parents be part of the feedback system?
I don't think so, because once you make feedback a formal occasion, it loses much of its value. It should be spontaneous, it should be every day, it should be based on direct observation. You can appraise the parents of the progress, but I don't think in the feedback process the parents should be step.
Okay. Okay, Dr. Tara is asking for pre-clinical subjects, multiple assessment from multiple integrated discipline or multiple